Today, Dr. Clinton Muench from the Orthopedic and Fracture Clinic here in Faribault joins us, and we are certainly looking forward to this. Oh, man, I forgot to bring in my phone, and I asked people to text questions, so I'm going to have to go get that while the good doctor talks here. Dr. Clinton Muench. Phone number, I should say the text number, is 507-838-5233. 507-838-5233. Thanks for coming in, Dr. Muench.
Good morning, Gordy. Thanks for having me.
Yeah, I do appreciate it. So you've been pretty busy. We were just chatting off the air, and you've been pretty busy.
It has been busy, yeah. People, unfortunately, always seem to get hurt, especially this time of year. We're busy with the sports seasons.
Oh, I'll bet you are. Football,
yeah,
volleyball.
Football. Yeah, yeah. Football's always a big injury sport, obviously, because of the collisions. Knee injuries or shoulder injuries, and unfortunately head injuries, which we don't typically deal with, but some of that. And then obviously, yeah, soccer, volleyball, all the sports are in full swing, and kids are getting injured, unfortunately.
Yeah, cross country. But
yeah,
I don't suppose
stress
you see a lot
fractures.
there.
Stress fractures, yeah, yeah. I mean, that's a common injury with distance runners. Yeah.
I'll be darned.
Yeah.
You do any running?
I do a little bit. Yeah. I'm not very good at it, so I gravitate away from it, but I force myself to do some. Yeah. Getting better.
Just trying to keep yourself in shape, I'm sure.
Yeah, exactly.
What sports do you enjoy? You golf?
I do play some golf, yeah, not very well, but I don't play tennis, no. Bowling. Golf and bowling, that's about all I do for sports.
You're a bowler, huh?
Oh yeah, yeah, love it.
Well, Jerry out at Bashers, the J&J Bowling Center, will love to hear that.
Jerry's a good guy, I like him.
Well, he says that, I can't remember, you use over 300 muscles when you bowl. I think that's what he said.
I believe it, yeah, I believe it. It's a good sport, it's fun, lifetime sport.
Yeah.
Both with golf and bowling.
So it is good for you, you're saying?
I think so. I mean, I think, you know, I like, I mean, I think to work out, it's not a very good sport to work out, you know, right? I mean, I think you need to do something, exactly, get your heart rate up, you know, heavy breathing, get your heart rate up, and do some weightlifting. You know, I think you can do those things at the gym or the senior center or whatever, but I think bowling is a good sport to maintain your flexibility and just socialize, really.
Okay, you just said something that caught my ear. You could
weightlift
at the senior center, so you would encourage the seniors to weightlift?
Absolutely, 100% yes. I tell my 85-year-old women they should be lifting weights.
Not a lot of weight, of course.
No, whatever weight they can handle. I mean, obviously it should be supervised by a personal trainer, you know, someone that knows technique to teach them how to do it safely, and they can do it, you know, within their means. But yeah, I think it's important to maintain your muscles and your bone strength. We were talking about bone mineral off the air also, and I think the best way to maintain your bone mineral is weight-bearing exercise, and one of those is lifting weights.
Well, I'll be darned. I learn something every day when you come on the show.
That's why I'm here.
I'm not saying that I don't know seniors that lift weights, but I guess I never heard it as a recommendation.
I think it's important, and I think it's often ignored. You know, I think our senior population, I think, are doing a better and better job, better than any generation, I would say, of maintaining their fitness. I see many, many retirees that spend 4 or 5 days a week at the gym. I think that's impressive.
Right.
And I think, you know, maintaining or improving your flexibility. Everybody works on cardio, right? That's kind of the big thing. That's why people go to the gym. But I don't think you should neglect your flexibility. That's a big thing, and lifting weights.
And how do you improve your flexibility? Stretching?
Yeah, stretching. More kind of a dynamic warm-up before your workout, and then more kind of the static stretching after your workout to maintain and improve your flexibility.
So we're talking weightlifting, we're talking about bench presses, squats, that sort of thing, not just the barbell.
Right, exactly. Not like the bodybuilder kind of bicep curls until your biceps are bleeding kind of thing, but more of a total body workout like squats, like clean and jerk, like snatch, those kind of you know, barbell exercises.
Well, that is very interesting. I'll be darned. We're going to take a
I didn't know we were going to go in that direction.
Oh, I'm sorry. But
That's perfect.
It's very interesting.
Oh, good.
We're going to talk more with the good doctor, Dr. Clinton Muench, and again, we'll take your questions. You can text them to 507-838-5233. I will have my phone in the next segment because during the break, I'm going to go get it. 507-838-5233. I find texting does seem to flow the program better. I don't have to, you know, transfer the phone and put the person on hold and then put them on the airwaves, which takes a little more time. The texting is perfect. 507-838-5233 again is the number, 507-838-5233. faribault.youtube.
Round people.
All right, thanks, John. Appreciate that. Again, your opening market report is service of Ag Power Enterprises, North End Buildings, also Metal Services out of Blooming Prairie, bringing you our opening market report. We'll visit with a good doctor. We have a question texted in. We'll get to that right after these words.
Breaks down, you need it repaired right away. You need to call Metal Services of Blooming Prairie. Metal Services has worked hard to earn a reputation for superior work in metal fabrication and repair. Metal Services team of certified experienced fabricators will have you back up and running in no time at all.
Is there a dietary and exercise program to prevent or lessen the effects of arthritis?
So when breakdowns happen, call Metal Services for proper repair service. Call 583-2144. Metal Services of Blooming Prairie, serving the farming community for over 30 years.
When you're in need of surgery, support is everything.
Off the bike
At the Orthopedic and Fracture Clinic, our experienced staff will help you with everything from scheduling appointments to dealing with your insurance company. We're with you every step of the way. I'm Dr. Clinton Muench with the Orthopedic and Fracture Clinic. I'm an experienced orthopedic surgeon specializing in arthroscopy and anterior hip surgeries. If you're in need of quality orthopedic care, visit ofc-clinic.com. The Orthopedic and Fracture Clinic. Better care, better value.
Wow, that was very good, Dr. Muench.
Sounded very professional.
I don't know.
Wow.
Maybe you're in the wrong business.
Oh, yeah, right. I've been told I have a voice for newspaper.
Really?
Yeah.
I've always
face
told
for
that
radio and a
I
voice
have
for
the face
newspaper.
for radio, yeah. Oh boy. Dr. Clinton Muench is with us from the Orthopedic and Fracture Clinic here in Faribault. I didn't notice this till I checked your website that you go with the European
We do, yeah, kind of the old way to spell it. Yeah, I kind of like that version, but yeah, either is appropriate.
Which is why I put that on our website. I mean, if your website says orthopedic with an A in it, then we should probably put the right,
yeah,
right?
Probably should, yeah.
I never did that before because I always was under the impression that
there was no A.
American, the American way, because I looked this up, is without the A. This is the old school version.
Yeah, I think so. We're old school. We've been in existence for a long time.
But it's good.
I like it.
Yeah. They both mean the same thing.
Exactly.
It's Orthopedic and Fracture Clinic.
Yeah, that's us.
Here in Faribault. So, let's see. Let's get to the text question, I guess, first. Bring it up here. Is there a dietary and exercise program to prevent or lessen the effects of arthritis?
That's a good question. I don't know that there's anything proven. Let's just start with that. But I think obesity is such a huge epidemic in our country that's a huge contributor, I think, to people developing arthritis. You know, the cartilage in our joints was not made to withstand the forces that go through them in someone that's overweight. And you know, climbing stairs, there's 3 to 7 times your body weight goes through your hip and your knees. So that's a tremendous amount of force in someone that's hugely overweight. So I think, you know, whatever you can do to manage your weight usually lessens the pain that people get from arthritis. Can you prevent it? I don't know. You know, that I think remains to be seen. I think, you know, some types of arthritis run in your family, and you may not be able to escape your genetics. But you know, the vast majority of the arthritis we see is oftentimes in association with obesity. And I think, you know, if you can get your weight under control, if you already have arthritis, that will make the pain better. And who knows, you know, maybe it will prevent arthritis if you're at a normal weight.
I'll be darned. Another thing I learned. I think we touched on this before, though, because I have arthritis. I have it's pretty bad in my hands.
Yes. Yeah, I think we have talked about it before. And I, you know, I think it's important to continue to talk about it. You know, at this point, we don't have a reason for why people get osteoarthritis, you know, degenerative arthritis. And, you know, who knows, maybe at some point we'll find out, you know, the gene that leads to it or what it is. It's, you know, it's like every other disease we see. It's probably part your genetics and part your environmental exposure.
Yeah. Well, I think probably genetics may be the biggest factor.
Yeah, it sure could be. I mean, we oftentimes see people, you know, who are in their 50s or 60s and both parents had both of their knees replaced and one hip, or, you know, whatever it is. You know, sisters, brothers, cousins. It can run in families.
Which reminds me, when would you suggest, because I've been told by friends of mine that they've been told I'm in my mid to late 50s. 57 is where I'm at right now. I've been told some friends of mine who are a few years younger than me that they've been told, even though they have pain in their knees or hips, they don't want to replace it that early. Is that early?
It is early. You know, the hip and knee replacement surgery was designed for old people. You know, and I don't consider 57 old. I don't think anybody considers 57 old. You know, and even, you know, they were designed for patients 65 and older, and I don't even consider 65 old anymore. I mean, in this county, I see people in their 80s that are high functioning all the time.
60's the new 40.
Exactly. So the problem is it was designed for people that were lower demand and, you know, didn't have a long life expectancy left, and it functions very well in that age group. You know, people that you know, walk to church and they do some light activity every week, it's going to work really well. It's going to last forever, and their implant is going to outlive them. You know, they're going to die with their implant well functioning. The problem is, as you ratchet down the age, then those patients have higher demands, they have higher expectations, and we can't make your hip or your knee normal. We can come pretty close, but we can't make it like it was when you were 20. And we certainly can't make it so that you can run and jump and pound on a hip or knee replacement. And the problem is that if you do it at a young age, you're likely then to outlive your implant. So your hip or knee may wear out and have to be redone. And then those outcomes aren't as good, and the risks involved with the surgery are somewhat higher. So that's the issue with trying to avoid hip and knee replacement in younger patients.
Yeah, I suppose it's what pain you can bear.
Yeah, and you know, unfortunately, we're forced to do it in, you know, younger age people like you, because they've tried everything else that we usually do to try to make the pain better, and they just can't tolerate the pain anymore.
Yeah, I was telling you that I didn't ride bike as much this past spring and summer because my knees would bug me when I did ride so bad. I mean, really painful bad. And I put this, I get it from Watkins. I don't mean to do a commercial here, but I call it Cremagesic. It's a really warm salve that you put on your knees or any other joints for that matter, and that seems to help.
Yeah, I think there's a lot of those kind of symptomatic treatments that people can try, and I'm for whatever works. You know, it doesn't matter to me, whatever you want to do to make it better, as long as it makes it better, you know.
But that kind of, it shouldn't preclude you from doing those things, but you know how it is. If you're physically not feeling good after you get done doing something, you don't want to do that something anymore.
Yeah, exactly. You know, maybe it's you know, maybe it's your technique, maybe it's the height of your seat, maybe it's your bike. You know, maybe biking is not for your knees. Maybe you should be rowing or elliptical or Nordic track or something like that. So I think your point is correct, though. You know, if it's painful after you do it, every time you do it, then you probably shouldn't be doing it. Your knees are telling you something's not right, and it's like, you know, one of those things, or maybe biking is not for your knees.
Well, that's unfortunate, because I love the bike.
Yeah. Maybe you'd love rowing better.
No, well, I did that as a kid. Maybe I should go to more, although I can't swim.
I'm talking about like an erg, like not actually on the water, like a machine.
Anyway, we have another texted question here. Is Bone Builders a good exercise program to go to?
Yeah, I think so. Again, it's any kind of weight-bearing exercise. I think is a good form of exercise. The other, and so whether it's, you know, Bone Builders or any one of them, I think as long as you're doing something to maintain your flexibility, increase your strength, and work on your cardiovascular fitness. And I think any combination of those things done safely and supervised, I think, is really important. And we kind of touched on it between segments. You know, clearly you want to make sure that your heart is safe to increase your heart rate. And so, you know, if you haven't exercised for 30 years and you're thinking about getting into a program, you should check with your doctor and make sure your heart is safe to do so. If you get chest pain every time you climb stairs, and now I'm telling you to get on the rower and row for 20 minutes and get your heart rate to 120, well, you know, maybe that's not for you. Check with your doctor first. But I think that kind of exercise is clearly important.
So how can you get your bone density checked? That's the latest text question.
A DEXA scan is really the best way to quantify your bone mineral. I get asked that a lot when we get an X-ray of somebody's hip or knee, and they say, "Well, how's my bone quality?"
Right.
And I can, you know, kind of subjectively say, "Well, you know, it looks pretty good." Or when we're operating on someone's bone, you can kind of subjectively say, you know, that was soft bone or that was hard bone. But really, the only objective way that I know of today is with a DEXA scan. And so the primary care docs order and interpret those. So we don't typically do those.
You don't do them?
We do not do those at our office, and we don't even order them. I usually leave that up to the primary care doc.
Because you don't, in your business, you don't need to know that? Or?
It's not really part of the orthopedic practice, at least not in mine. You know, I'm not going to put people on vitamin D and calcium and Forteo and all that. There's a bunch of new medication to try to maintain and improve your bone mineral, and it's just not part of our practice, really.
Just got to drink milk.
Well, I think the calcium part of it is good. There may be other things in milk that are inflammatory, maybe not the best for you. Some form of calcium, I think, is key, and whether it's a supplement or milk or green leafy vegetables, whatever it is, I think you need calcium.
Well, I'd be very curious to hear your take on this, because I've always been a believer that natural is better than a supplement.
Yeah, I think you're true. I think you're right. I mean, I think it, and of course, it depends on the supplement. Like, it's difficult in our latitude to get a natural source of vitamin D, and most of us are vitamin D deficient. So really, you don't have a choice there other than a supplement.
Well, I get orange juice that has vitamin D added.
Right, but it's added, right? It's not natural; it was added in.
Well, that's true.
So yeah, so in that circumstance, I think I think a supplement there is perfect, and I think most of us should be on vitamin D.
And again, milk has vitamin D.
It does. Yep.
Not that I'm promoting milk here.
Sounds like a milk commercial.
Okay. That question just got back to me again for some reason. 507-838-5233. All good questions. We appreciate the text of questions, right, Doc?
Yes, we do. Keep them coming.
Clinton Muench, 507-838-5233 is our number. Getting back to the arthritis, do you see a lot of arthritic patients, or do you deal with that at the Orthopedic and Fracture Clinic?
Yeah, that's a huge part of our practice. We do orthopedic trauma, so sprains, strains, and fractures. But then a huge part of our practice is arthritis, and there are millions of Americans that are suffering from arthritis. Right. I think it's one of the biggest diseases that cause disability in this country. And our seniors are more and more mobile and want to maintain their mobility more than any other generation before us. I hear that all the time. I just want to stay active. I just want to continue to play pickleball, right? I want to chase my grandkids, and so arthritis is a very debilitating and limiting disease. And so we see thousands of patients a year that have arthritis.
It's painful.
Sure is.
But as you said, we really don't know what causes it, right?
We don't. There's no cure for it other than joint replacement. All of the other non-operative things we do just try to manage the painful symptoms.
So you're saying that if you replaced my knees, I would no longer feel that pain that I feel after biking?
Correct. Pain from arthritis is cured after joint replacement.
But
that's the only cure. Well, we'd have to talk about that in the office. But yeah, I mean, that's the only cure. Every other thing we do, the anti-inflammatories, over-the-counter pain medication, bracing therapy, injections, all those do are just help you manage the pain.
Yeah, I don't know how much bracing helps.
I think it helps some, especially there's not a good hip brace, but for knee issues, whether it's sprain, strain, or knee arthritis, if you have some compression on your knee, it tends to make it feel better.
See, I'm starting to get it in my hips too. Is it normal that it progresses throughout your body, or?
Not typically, no. Not with osteoarthritis, not wear and tear arthritis. That doesn't affect every joint in your body. Like rheumatoid arthritis, that's an inflammatory arthritis, and it literally affects every joint in your body from head to toe. Osteoarthritis, it is very hit or miss. It might be one knee, it might be one hip, it might be both knees but not your hips. It might, like you said before, it might be your fingers but no other joint. Hit or miss.
So I must have the rheumatoid variety.
Hard to say. I'm not sure. You need a workup.
Yeah, I need a workup. I need a lot of work. Anyway, our phone number to text those questions again is 507-838-5233. I didn't notice on your website. By the way, you do have a nice website, Doc.
Excellent. Thank you.
I did notice on your website, though, that you have something called OFC Express.
Yes.
Explain that to our
listeners,
new.
Please. And unfortunately, right now, it's only available in Mankato.
Oh.
So it's our orthopedic urgent care walk-in clinic and after-hours clinic for people that need more kind of urgent care. Unfortunately, right now, it's not available in Faribault.
Oh, okay. Do you see that coming down the pike or not?
Potentially. I mean, we're always evaluating those kind of options and trying to gauge whether there's a need.
There are 20 orthopedic surgeons on staff.
There are, a lot of us, yes.
5 physical therapists, and 7 athletic trainers.
I think we have more PTs than that, but if you
Well, that's what it showed on your website.
well,
May not be updated,
that might not be.
you know, with the PTs.
Yeah, and obviously we don't have 20 orthopedic surgeons here in Faribault.
Right,
There are
right.
3 of us here, but you know the majority of our partners are out of Mankato, where we have a bigger practice.
And do you consult on a regular basis, Dr. Muench, with other orthopedic surgeons in other places that might be able to assist you with a particular
Oh,
case?
absolutely. Yeah, absolutely. We've never talked about that. Interesting. We do that all the time. Interestingly, you know, we run across things that are unusual or complex or things you may have never seen before, only heard about or read about, and so I contact my partners all the time and run cases by them, and they do the same with me, and so it's oftentimes a collaborative effort.
What's your favorite thing to do in the practice?
Oh my gosh, probably joint replacement. I think at this point in my career, hip and knee replacement, shoulder replacement. Yeah, I mean I still love sports. I love ACL reconstruction, rotator cuff repair, knee arthroscopy for meniscus tears. I still love that stuff, but there's very little that we do that provides more patient satisfaction than joint replacement. You know, the elderly farmer that's been milking cows for 50 years and has horrible arthritis in his knees and can't stand up and can't get around. You replace his knees and he thinks it's the greatest thing ever. And there's a lot of job satisfaction in that.
Now, I've been told by a few people that have had knee replacements they should have done it 10 years earlier.
Yeah, that is a common statement after knee or hip or shoulder replacement. Very common.
But then again, it's kind of a catch-22, right, Doc? Because you really don't want to do it too soon.
Yeah, because of the reasons we talked about earlier. Yeah, you know, younger patients, they tend to have a lot more pain after the surgery, and I always worry about expectations, and I always have a discussion with the patient about their expectations, and the younger patients, like I said before, they have higher expectations, higher demands
Right.
for their life and their job, and oftentimes a joint replacement can't deliver on those expectations, and so I try to be sure pre-op that their expectations are realistic.
Now, I've had friends of mine who have had various, like I say, knee replacements or hip replacements or something, and it varies with a person as to the rehab. Some have said rehab was very difficult, others have said it was a piece of cake. So I'm sure that varies with each person too, right?
It does, yeah. I think that's quite variable, although I don't think any of my patients come back after knee replacement and say the rehab was easy. You know, that's a very difficult joint to rehab after a joint replacement because it has a lot of flexibility, and you need that flexibility to function.
And you have to do it right away, so there's going to be pain.
There is, exactly. So rotator cuff rehab and knee replacement rehab are both very difficult. Hip rehab is much more reasonable, far less painful, and not as much involved.
Now, when you think about it, you don't move your hips as much.
Exactly. There's not that freedom of range of motion, and you don't need a large amount of range of motion to have good function with hip replacement.
But I'm sure you have medication to handle the pain, right, or not?
We do, yeah. We do a multimodal pain management program after surgery to make the pain tolerable. And I would say that's probably where we've made the most gains or the most changes, the most advances in knee replacement, especially in the last 15 years since I've been here.
And, you know, Prince passed away last April. He was addicted to painkillers.
He was. Yeah, it's an epidemic. It's a huge problem. So we're trying to minimize the use of narcotics. Scary.
So there's the other catch-22 situation. You know, you don't want to get them addicted to painkillers.
No.
You don't want them to suffer from pain.
Yeah. So then
At
some point it is, and at some point then patients feel like they don't have any other choice except to have a joint replacement.
You know, back in the Civil War days, the guys would bite a bullet and have a shot of whiskey when they were getting ready to cut into them.
Yeah.
Surgery, you know.
Yeah. Those general surgeons that did amputations on the field could do an amputation from a traumatic injury during war in like seconds. They had to.
Oh boy. Again, the number to text if you have a question is 507-838-5233. That's 507-838-5233. If you would please text in your questions, that would be awesome. Only have a few minutes left in the show, and just want to make sure we touch on everything you'd like to get the word out on.
That sounds great. We should talk about our phone number, where you reach us also.
Of course.
Our number is 507-334-1601.
1601. And I would guess that you have a wide area that you cover. I mean, Kenyon, Waterville, Morristown. I mean, people from all over come.
We
to
do,
Fairfield.
yeah, yeah. Owatonna, Albert Lee, yeah, from everywhere.
I didn't even think of Owatonna and Albert Lee.
Yeah, they drive up, they come see us.
But they make the trip to the Orthopedic and Fracture Clinic. So, people will come in, you'll check them out, you'll tell them whether they're a candidate or not for what they're wondering about.
Yeah, I mean, the first thing is to take a detailed history, so listen to their story, and then do a comprehensive physical exam for their particular complaint, knee pain, shoulder pain, hip pain, whatever it is. Oftentimes get x-rays, and then depending on that information, make a diagnosis, and then determine what the next step is. Do you need an advanced imaging study like a CT scan or an MRI scan? Do you need therapy? Do you need an injection? Do you need surgery?
And you can help people with, for example, you have a back care center, I see, in the
We do.
Orthopedic and Fracture
We
Clinic.
do. We have a physician that sees back and neck pain, and we have therapists and a whole therapy area for back and neck pain.
And boy, I have to tell you, what little bit of back pain, my dad had back issues, but what little bit of back pain I've suffered over the years, it is grueling. I'm glad I don't have a, chronic back
problem. Yeah, it's terrible, and it affects a lot of people. Again, oftentimes it's arthritis in your low back. It's kind of the same as the hip and knee arthritis part of it. It affects a lot of people.
And some of it comes from not lifting properly, I'm sure.
Yeah,
Things like
exactly. Injuries like that occur.
I don't mean weightlifting. I'm talking lifting things.
Yeah,
boxes and
that's
things.
all the more reason to work on your weightlifting and your technique so that you don't get injured. Lifting a couch or lifting whatever off the floor, a box, or whatever it is.
Well, I did the boneheaded thing in my mid-30s playing softball, not warming up before a game, and I threw my shoulder out.
Oh yeah, that's common. The weekend warrior.
It wasn't very smart. But what are the odds, though? I go into center field, first inning you get a ball hit, and of course I did one of these step in and over
the head. Yeah.
So I had to run back to the fence to pick it up, and I hadn't warmed up, and I whipped it into third base, and I could feel like.
Sounds like rotator cuff tear.
Oh
scary.
my, that did not feel good
No.
at all. Well, I sure appreciate you coming in, Doc. I know we only have seconds left of the show, so we probably couldn't attack any other questions, but I do appreciate it.
Thanks for having me, Gordy. I appreciate it.
I know our listeners appreciate it too, as evidenced by the questions, and we certainly appreciate all those today too. In the number, well, I won't give you the number again. We're gonna dump out of here. The next couple of days, we do have some other guests coming our way. The order to which we don't know just yet, so we'll let you know that as soon as we get it finalized. Okay. That concludes today's edition of AM Minnesota on KDHL AM in Faribault, Minnesota. Hope you can get out and enjoy this beautiful